Here's the inguinal ligament. It's a strong band of tendinous tissue that goes from the anterior superior iliac spine to the pubic tubercle. There's a gap between the inguinal ligament and the underlying bone. Through this gap, some important structures pass from the abdomen to the thigh, including the femoral vein, artery, and nerve medially, and the belly of the psoas and iliacus muscles laterally. The inguinal ligament isn't an isolated structure. As we'll see, it's the lowest part of the external oblique aponeurosis, which is the outermost of the muscular and tendinous layers of the anterior abdominal wall. Now, we'll move on to look at the muscles that make up the wall that surrounds the abdominal cavity. We'll begin with the muscles which, along with the vertebral column and the diaphragm, form the posterior part of the abdominal wall. We'll look at the erector spinae muscles and their surrounding fascia, then at quadratus lumborum, then at psoas major and iliacus. We're looking from behind. Here's the iliac crest, here's the 12th rib, here's the midline. Here are the muscles known collectively as the erector spinae. We looked at them in the first section of this tape. They arise from the sacrum and from this part of the iliac crest. They're inserted on the thoracic vertebrae and on the backs of the ribs. The erector spinae muscles are enclosed on the front and on the back by this envelope of tendinous tissue called the thoracolumbar fascia. The layer on the back of the erector spinae arises from the spinous processes. The layer on the front arises from the transverse processes. The two layers of thoracolumbar fascia fuse into one thick layer along the border of erector spinae. The thoracolumbar fascia is an important attachment for muscles of the abdominal wall, as we'll see shortly. Next, we'll add quadratus lumborum to the picture. Here's quadratus lumborum. It lies in front of the erector spinae muscles and their investing fascia. Quadratus lumborum arises from the 12th rib and the transverse processes of the upper three lumbar vertebrae. It's inserted on the most medial part of the iliac crest and the transverse process of L5. Quadratus lumborum assists in producing lateral flexion of the lumbar spine. Lying medial to quadratus lumborum is psoas major. Psoas major arises from the transverse processes, vertebral bodies, and intervertebral discs from T12 to L5. It runs down across the alar of the sacrum, across the sacroiliac joint, and along the pelvic brim. Before seeing where psoas major goes, we'll add its close neighbor, iliacus, to the picture. Here's the iliacus muscle. It fills the iliac fossa. Iliacus arises from this wide area on the wing of the ilium. Down here, the medial fibers of iliacus and the lateral fibers of psoas major join, forming a single muscle belly known as the iliopsoas. The iliopsoas runs beneath the inguinal ligament and passes backwards to insert here on the lesser trochanter of the femur. As they slope downward and forward toward the inguinal ligament, the iliacus and psoas muscles are covered by this layer of dense connective tissue, the iliacus fascia, which we'll meet when we look at the inguinal ligament. This is just the lower part of it. The iliacus fascia is covered in turn by the membrane which lines the abdominal cavity, the peritoneum. This is a preview of the peritoneum. We'll see it more fully later in this section. When we're looking at the abdomen, we tend to see psoas and iliacus as static background structures, but they have an important function. They're the principal muscles that produce flexion at the hip joint.